Okay guys, we have here, you can see some blackheads. We'll come along the side here, some pretty good clogged pores. Down here, some inflammatory pustules and nodules. Blackheads up here, and we have a couple in the ear on the other side we're gonna get today too. So we're gonna be doing several different techniques here to clear these pores for her and just get her clear. This is on this side here, you can see some of those. So, okay guys, MrPopZit here. We've got quite a few different types. We got some whiteheads, blackheads. We're gonna be getting these out. A little bit of pressure. There you go. Let me know if it's too much pressure or it's stinging. I like to get under these and just roll them out there. Looks good. Sometimes little hairs in there. This inflammatory one here. Kind of work that out. Sometimes little hair in there you'll see too. Little blackhead right there. You can see that hair all rolled up in there. Very good. We're gonna get these blackheads on the neck here. The neck, because it's so soft, can be a little tricky to get behind them. So you just gotta pull the skin, tighten it, and roll those out just like that. Perfect. You can see there little hair follicles in those as well. Blackheads with a follicle. You can see that little hair in there. So that is good. She does have a couple down here too. Down in the hair. Pull that tight and a little squeeze. It's a whitehead. Pretty good sized blackhead right here as well. You see that? There we go. Big pop there. Quite a few hairs on there too. So that's good. Okay. So now we're gonna come up here, show some blackheads on the cheek. Get under that, and a little squeeze. Perfect. Over here. Stretching that skin to make sure we get all the way under, and that little push, I usually push one against the other, just like that. That's good. Now when we get them on acne treatment, you'll see some of these others starting to dry up, which is happening there. That's good. The bigger ones still have some keratin, this buildup in the pore there. Little whitehead, we'll just get that one for. One right on the lip right there. Perfect. Little hair in that one too, very skinny one. So you can see a lot of those are clearing out. That's good from the treatments we're doing. So we're gonna come over here. Just got a little one right there, little pressure. So we also do laser resurfacing. We just did a test spot for her, so she's getting just a little bit of mild peeling there. That's okay. Looks like she didn't hyperpigment, so I always do a test spot to make sure they can tolerate the laser. It looks like she's gonna tolerate it very well. Very good. Here, low pressure. Pain's not bad, right? Perfect. That's tightening that up very nicely. There's one right here in the eyebrow. It's just a little whitehead there. That's good. This one looks like it's drying up here. Just an old dry plug. Right there. And a couple up here on the forehead. These are small. Looks like they're drying up from a retinoid, so you don't get much out of these. We still try though. There we go. Just little teeny tiny plugs you can see right there. And she doesn't have a lot of those. Little blackhead. Okay. That's looking good. Now on the nose here, she does have just a few on the tip there as we move down, some finger squeeze. See over here and there. And I'm not squeezing hard, just a light kind of rolling with the tip of the finger and we get those out. That's good. Okay, now we can go on the other side. We're gonna come over here first. Now we're on the other side. Right here's an inflammatory one here. Just a little squeeze there, get that pus out. That one may be a little tender, sorry. It's kind of a big clogged pore. There we go. Probably felt that one pop. We had quite a bit in there and a little core right there. So we got that clear for you. Very good. Well, it's just like a little cystic acne there. We'll end up getting a Band-Aid for her there. It's good. We'll come down here. Pretty good blackhead right here. Probably a hair. We're going to find out. Just rolling that right off the other. Perfect. Nice dry plug there. Same with this one, most likely. Starting to roll out. It's kind of dried up on that one. Right there's a little one. Good. Got one more right here. Little plugs. Not bad. Good to stretch the skin so you can see under there. And come up here to just a couple blackheads on the cheek here. First one, little pressure. Good. Up here. Temple's pretty good size one there. Big plug. Some hair in there, keratin. Make sure to squeeze that base. Got all that out. It's like a little shrimp, actually. There's a little hair in there. Curled up. Clear that whole pore. Sensitive area here, so you feel a little pressure, okay? Mm-hmm. Good. We get to see that soft yellow at the bottom. We know that's the bottom plug. Another one right there. Pushing deep. Rolling it out. She's doing great. That's a sensitive area, so this one's even more sensitive here. Almost there. Got it. Perfect. Good job. She's a trooper. So the ear can be a little tricky. You can see here. You can see we have a couple blackheads. We're going to start with this one. This can hurt a little, so if I'm pressing too hard, let me know. Mm-hmm. Almost got it. Here it comes. Good. You did great. Nice plug there. And it's cartilage behind there, so it's hard. Press this one here. My finger in the back there. Here it comes. Good. She's very strong. And this deep one here. That one's going to be a little tricky, sorry. A little pressure. And one right beside it. Got it. Very good. Getting little plugs out of each one of these. So that one right here, we're going to go down from this angle. Pressure, here it comes. Switch it up that way. Good. Perfect. Kind of a, might even be a little hair in that one. Little stringer at the end there. That's the bottom. Looks like a little hair too. Very good. So clear those out. They'll refill eventually, but that looks good. We got all those in there. Don't see any down here. Just have one big blackhead there, and then we'll be done. This is our last blackhead here, guys. You can see good lighting on that. Get under and push up. Get that ingrown hair out of there, and you can see that little plug. Looks like she may have two others right here. We're gonna do a little poke on, see if we can get this right here. There we go. You might have felt that pop. There was quite a bit in there. Dead skin, keratin there, kind of juicy one. And one more right here. One more right here. Come from underneath it. There we go. Getting that blurry.
It was there.
It's okay. Got it now. We got that rolled up hair in there. That one was pretty good. Quite long, actually. You can see there's a big old hair, couple hairs rolled up in there with a little blackhead plug and then all that keratin underneath. So that was good. Got those cleared out for her. Get her a couple band-aids here on some of the bigger ones we did. Okay, guys. That was classic extractions. We had blackheads, whiteheads, you know, all these comedones. And then some little milia or clogged pores and a lot of ingrown hairs. So thanks for popping by. Thanks to my patient for sharing. And we'll see you guys soon.